Hello, everyone, and welcome to the second day of the Responsible AI Forum preview. My name is Caitlin Corrigan, and I am the Scientific Coordinator of the Institute for Ethics and Artificial Intelligence. Yesterday, if you were able to attend, you saw 3 excellent panels with members of the various IEAI research projects, as well as people from our Responsible AI Network Africa. Those sessions will be available on the IAI YouTube channel soon, so you'll be able to watch them or catch up on the ones you weren't able to attend. But today we have 2 excellent panels to finish up our Responsible AI Forum preview, and I will be moderating the first session on exchange and partnership for responsible use of AI in pandemics, the Global AI Ethics Consortium. Independent academic research plays a fundamental role in designing and implementing frameworks and guidelines for the development and use of AI-based technologies. Academic expertise drawn from across disciplines and geographies is critical in helping guide governments, companies, NGOs, and other actors as they navigate current uncertainties and arrive at sound and justifiable responses. Consequently, several experts across multiple continents agreed this spring to form a global AI ethics consortium. We have continued to grow over the course of the year, and we are currently up to 20 experts from 6 continents, with members from 16 different academic and research institutions, including in Germany, Spain, Brazil, the UK, Singapore, France, Japan, Belgium, Ghana, Australia, the US, and China. The GAIEC aims to foster collaboration on research related to AI ethics, as well as promote guidelines for the responsible development and use of AI-based technology. We met a few of our members from the GAIEC in session 1 yesterday, who will be working with our tomb-based partners on new research projects related specifically to the use of AI in health crises. But today I would like to introduce you to several more of our members to discuss the role of exchange and partnership in promoting a global perspective of AI ethics. Our excellent panel includes, first of all, Christoph Lüdke, live from Munich, who you've all met yesterday. He's a full professor of business ethics and the director of our Institute for Ethics and Artificial Intelligence at the Technical University of Munich. He's a member of the scientific board of the European AI Ethics Initiative, AI for People, as well as the German Ethics Commission on Automated and Connected Driving. Rafael Calvo is live from the UK, a professor and the director of research at the Dyson School of Design Engineering in Imperial College London. He focuses on the design of systems that support well-being in areas of mental health, medicine, and education, and on the ethical challenges raised by these new technologies. He will also be working with us on our new project, building strategic partnerships to understand ethics and the use of AI to manage health-related crises, along with our partners in the University of Tokyo. So welcome. Next, we also have Jean-Gabriel Garnacha live from Paris. He's a professor of computer science at the Sorbonne with a background in engineering and philosophy. He leads the LIP6 laboratory at the Sorbonne and chairs the French National Center for Scientific Research's Ethics Committee. Welcome, Jean-Gabriel. And finally, we have Yi Xing live from Beijing, a professor and deputy director at the Research Center for Brain-Inspired Artificial Intelligence and director of the China-UK Research Center for AI Ethics and Governance at the Chinese Academy of Sciences. He is also a member of the National Governance Committee for the New Generation Artificial Intelligence, the UNESCO Ad Hoc Expert Group on AI Ethics, and the WHO Expert Group, WHO Expert Group on AI Ethics and Governance for Healthcare. He's also director of the Research Center for AI Ethics and Governance at the Beijing Academy for Artificial Intelligence. Welcome to all of you. With that, I would like to give each panel member a few minutes to speak about their work and their perspectives on this topic, and we'll start with Christoph.
Thank you very much, Caitlin. And I would like to highlight again that this is also your work, and thanks to your efforts, we are here today, and we managed to hold this institute and the events that we do. So let me talk a bit about the Global AI Ethics Consortium and about the plan behind that. So immediately when the Corona crisis started, I felt that we would need to see some first some international collaboration effort in order to combat this pandemic, but also to become active and not just watch passively what is going on. I think this is a responsibility actually that we have as academics, to not just watch but to do something in the to the extent that we can, of course. But it was clear that AI would play a part in combating this crisis, and it would have been a new challenge that became very clear very soon. However, it was also clear that it was not just AI that would be able to do the thing, but responsible AI. So AI, if left to its own devices, and we talked about that yesterday in our sessions, could also lead to a lot of negative effects, and some of which we may see already. I felt that it was necessary to promote the use of responsible AI, and with the right guidelines, I believe that AI can do a lot of good things in this regard, and this is also something I believe that we witness today. But I thought we needed some framework for that, and we have already many efforts going on around the globe. If you consider that AI ethics hasn't been around for very long, I mean, some efforts go back a little longer than others, but the coordinated and systematic efforts in this regard go back mainly 2 years ago, maybe, and we have seen a number of international guidelines being developed and passed by a lot of institutions around the globe, the high-level expert group in Europe, the AI for People, the Beijing AI principles that we have seen, and a number of others, the Partnership on AI and others. So, and if you look at them closely and compare these, you'll also see that there's a lot of consensus and a huge degree of overlap between them. While some say, well, we have fundamentally different opinions on AI ethics around the globe, I do not think that is the case. Certainly there are some differences, and there will always be issues where we differ, but in general, I would say more than 80%, if asked, we have a lot of consensus. And that's why I think I thought it would make sense to bring all those researchers together who are working on this in this new field, and who are doing a lot of excellent work in many places around the globe, and learn from them, and eventually put together research projects, which we now managed to get already some underway, and we will certainly see more in the near future, on different topics. Now we are focusing mostly on AI ethics in healthcare and pandemics, but we will certainly broaden this scope in the near future. For example, the autonomous driving is something which is a very major issue around the globe, and international organizations like the ITU or the IEEE are working on developing standards, not just technical standards, but actually those that extend into the domain of ethics, in the broad sense at least. And maybe last point, the circles that have been working on these ethical guidelines for AI are also still active and now developing more concrete guidelines, such as the AI for People, of which I'm a member. We will present new guidelines, domain-specific guidelines, at the beginning of December at the AI for People Summit, and that actually goes hand in hand with what we are doing and the efforts we are witnessing here in the consortium. So I would just like to say I'm very grateful and thankful that so many colleagues, as some of those who are here, but also others that were in our session yesterday and who are with us in the consortium, could join us in the efforts. And I'm looking very much forward to continuing to collaborate with you all. Thank you.
Thank you, Christoph. We can get back to some of those discussion points later after everyone has a chance to introduce themselves. We'll just keep going in the order I introduced you. So Raphael, maybe you can say a few words.
Thank you, Caitlin and Christoph for inviting me and to be part of these discussions. You know, the projects like Christoph described are really, really interesting. And as a way to trigger maybe a different type of discussions today, I would like to bring up to you the importance of using health and motivational psychology in the design of intelligent systems. Now, systems that use AI, such as, for example, contact tracing apps. And despite the amount of investment and discussions on contact tracing apps, there are now doubts about the impact they are having. And I think these doubts are useful for us to look into responsibility and trust. They generally have had a low level of engagement. And these statistics here are for the US, and were published in an article in Wire magazine last week, and they are dismal. In the UK and other countries in Europe, the numbers are not that much better, I believe, and they have had uneven, let's call them, starts. Now, despite being an engineer and recognizing the technical problems in the way that some of these systems were built, I think the failures are not only technical. Improving the impact of such systems will not be a matter of, for example, improving the accuracy of an AI algorithm or improving the accuracy of detecting a Bluetooth signal. The failures to engage people with the app are a result of policy decisions, the way the health issues are communicated within and outside the app or outside the system, and of course, the design that brings all these things together. One way to study how these things come together, if we want these technologies to be more successful in the future, is to look at design and psychology. In our research group, we have been bringing evidence from motivational psychology to this design practice and have found that systems, including those designed to help us during this pandemic, are more engaging when they support the satisfaction of these three psychological needs. The first is autonomy, the feeling of willingness and volition in action. An autonomy supportive system does not have to be fun, as sometimes we think, but it has to be aligned with our values. Our sense of autonomy is hindered, for example, when we think that we are being forced to do something, or when we think that the tool or the behavior goes against our values. This is why politicizing public health communications has resulted in such divided adoption of health technologies, including not just intelligent systems, but also simple things like masks. The sense of competence, this means feeling able and effective, refers to the need that we have for these competence abilities. People is less likely to engage with an intelligent system that is hard to use. Personally, I think there should be a mandate that any health measure announced by the government should come with an explanation that even a 7-year-old can understand. And then finally, relatedness. Everybody wants to be part of a community. Messages that help people feel connected to others are more likely to be successful. The NHS here in the UK has done a very good campaign in this sense. To be effective, intelligent systems focus not only on the me, they should also focus on the community, on what it can do to help the nation, or in this case, the NHS workers. The ethical questions raised by health surveillance will only increase. Often they are framed as zero-sum trade-offs between security and privacy. But the psychology of autonomy suggests a productive alternative when both sides endorse well-being as they join value goal. Health surveillance can be a positive sum game, both effective and choosing freely. Thank you.
Thank you, Rafael. We'll hear next from Jean-Gabriel.
So I have a small slide I would like to share with you. So this is my, do you see my slide?
Yes, we do.
Okay. Okay. So what I would like to do is first to try to give an overview of the different application of artificial intelligence to the pandemics, and few of them are very problematic, and this is what I call irresponsible AI, but many of them are also very useful, and we shall focus on this very useful application of AI. And then I would like to end with some ethical considerations. So the first point is what are irresponsible AI? So first thing, we have to understand that AI is understood here in a broad meaning, because AI as a discipline of computer science can be restricted, for instance, to machine learning or different things. But here we understand AI as all the digital techniques that can be used. So here you have something like surveillance systems that could track people, or public systems that could cast a problem on people who disobey rule, or AI generation engines generate some fake news or fake deep fakes, etc. So all these kind of things are very terrible. And this is the reason why we need to focus on responsible AI. So here there are some examples. For instance, modeling the pandemic use either mathematical modeling, but also AI models using multi-agent system, which are very, very interesting. And here in medical application, you may have different AI techniques which can be used. For instance, we can process huge amounts of medical data from patient analysis, etc., or we can try to extract biological information, genetic factor, for instance, which explains the evolution of the disease. All these kinds of things are very useful. In bioinformatics, you can try to model a biological process, for instance, to understand what are the mechanism of introduction of the virus into cells. So these are just some example of all the application of artificial intelligence. And the last one, I think, which is very important, the fact that you remember last 6 months, there were an enormous amount of paper dealing with COVID. We count more than 60,000 paper on COVID-19. It's very important today to have some AI tools that could make us able to extract knowledge from all these papers to help scientists. So these are examples of application. And the last one I think is very important. This and many people focus on this, but I want to say that these are not the only application of AI and not the only application of responsible AI. So you have different apps. So for instance, I mentioned here an app that I know, which is called Compass, which help to diagnose and to anticipate the status of people, to make them able to work if they have no risk to be contagious in companies. So it's a small apps which use some AI techniques, and I think it's very important. And the last one are the tracing apps. And we had many people who refer to tracing apps for good or bad reason. And I think that we can discuss this point. It's very, very important. So we had ethical issue related with these apps, and some ethical issue which were related to privacy protection. and we need to be sure that these apps are compliant with the existing rule, for instance, with GDPR. This is very important. And we had to check that these apps don't infringe a right, for instance, right of freedom of peaceful assembly. It's very, very important. And so what is our role nowadays? Is when we think to these apps, to this application of AI, to be sure that these are ethically safe, and this is what we call responsible AI. So it's very, very concrete discussion, and also we have to, and it's very important, I will come back on that, we have some balance between privacy protection, which is very important, but also as a requirement, it's a requirement for solidarity. So if this app is very useful, it's very important to use it. So I would like to end this slide with a very funny history. You know, in France, we had many discussions about this app, and it was called Stop COVID. And only a few people accepted to download these apps on their mobile phone, only less than 2 million of people. And the government feared the reaction of people. And here in October, the 22nd of October, so a few less than a month ago, then they rebuilt the application. This is the same kernel of the application. They changed the name, they add some facilities, and this new application is called now Tous Anti-COVID, which is a ridiculous name, but it's not a problem. And it's very interesting. You see here, on this photo, you say bonjour. And with this application was downloaded more than 8 million, near 9 million times. And it continued to be downloaded. So it's very important to understand this point. To be accepted, you need some communication. It's very important. And so. And I would add also a funny point considering this application. You had a lot of debate about the architecture, the centralized, decentralized architecture. And so many people prefer decentralized architecture because they fear that their data come to the government and they could use against them. And you had different protocols. You have a French-German protocol, the robot protocol, which was not used by German people, which would prefer the GAIEC protocol. And you had problem with interoperability, which are very interesting problem. And I had information last few days. I'm not a specialist of cryptography, but as a computer scientist, I have some idea about this. And we realized that, in fact, the GAIEC protocol, the Google Apple encryption protocol, in fact, was not really safe for different reasons. And it is not decentralized, because I realized that, in fact, this is also a centralized protocol, but centralization is not exactly the same. So we need to explain this to people and to discuss all these points. So you have some technical problem and you have some ethical problem. And I would like to end this by some ethical consideration. You know, you have many ethics committee who try to generate some, to write some report and to say, okay, we need to express some principle, which could be very general and used by many people, and to try to regulate the AI and to introduce new law, etc. And I would like to end with a consideration from a French philosopher who lived during the 20th century, especially during, he was very active in the 40s and 70s. His name is Vladimir Yankelevich. And here, what he's saying is that what is difficult with ethics is that we cannot restrict to one principle or to one virtue, that we need to balance the different virtue. And here, I just read this, evil is a disjunction of virtues. It is to have a virtue without the others. Evil is to be courageous without being sincere, sincere without being just, and so on. And now we can say today, for us in the digital age, evil means defending privacy without worrying about transparency. It means promoting transparency without censoring the security of individuals. It means defending security without worrying about freedom, and so on. So What I want to say to conclude is that ethics is not just a question of principle, but also it's a question of balance between principle. The role of digital ethics is to discuss the necessary compromise between this virtue or principles in each concrete situation. So thank you.
Thank you very much for that. I also, before we'll give Yi a chance to talk, I also forgot to mention at the beginning to everyone that following our last presentation, we will have a Q&A session, and all the audience members can use the Q&A tool to submit questions at any time, you know, as we go through the process, and we'll go through them afterwards. So with that, I go to Yi for our last presentation.
Okay, can you see the change of the slide? Yeah, can you see it?
Yes, yeah.
Okay, thank you everyone, and especially thank you for TMU for the invitation. I think I wanted to provide a complementary understanding based on the previous speakers. But just like the previous speaker mentioned, that AI has been used in various ways in fighting against COVID-19. So ranging from automated surveillance, drug discovery, virus host prediction, and also automated dialogue system along with robots, subtype variation recognition of the structure, and also CT image recognition. Many more, like voice recognition to detect COVID-19. So, but for each of the trines, like we've been summarizing, there will be very different potential ethical and safety challenges. So this is why we need a ethical framework for each of the trines to keep them safe and use it in a responsible way. There are many trines by using AI, but people may not really like it. So we did a survey around facial recognition and public health in the period of the pandemics. There are more than 1,000 people participating in this survey from all the provinces in China. So the major observation is that when people are talking about, oh, during the pandemics, maybe we could actually just forget a little bit about our privacy and to ensure the safety. And then the survey says that no, people never said that. What people says is that if you want to keep a public health infrastructure, if I have to give you some of my private information, or you have to keep them safe first, or otherwise it's not their choice. So they don't like the way that if you don't really keep the data safe, and you ask more information, even during the like the picture that I show in the right, you see this is the Chinese version of the contact tracing app. So at the bottom it says the data is managed by the Beijing Big Data Center. So in this case, you know where the data goes. If something went wrong, it's not that you have to criticize Tencent or Alibaba, who is creating those apps. Actually, you have to go to the Beijing Big Data Center because it's a government maintained organization who is running this app. So people, as always, they're very sensitive to their private data, even during this pandemics. I think, on the other hand, it will be relatively easier to actually being a philosophical king. So everybody is talking about in which way we could actually create a more ethical app. But you see that for the evaluations in many of versions, they never talk about the effectiveness of this platform. So in this case, you could have apps that act very ethically, but actually it's not really effective. In this case, if the efforts do not bring us the effectiveness, why bother to introduce the technology that are with potential ethical risks? So you see that in some of the surveys, the Chinese app has been criticized for the ethics point of view because it's required, it's not optional. In some cases, like at the beginning, they have to make sure, oh, this is really your mobile, not that you're using others' mobile. But I see some of the reasons. And then you see stories happening in India that they are forcing people to use the COVID app. And later, there are summaries from the Wall Street saying the contact tracing in the West, big hope for suppressing COVID-19 is in disarray. So you have to, like the previous speakers covers, actually the balance is required information minimization plus responsible service. It's not that you ask a lot of information, or on the other hand, you cannot keep them safe. So if you really ask the information, who is taking the responsibilities? It has to be quite clear. In China, the apps are local versions. So because I'm in Beijing, I know that the data goes for the Beijing Big Data Center. If something goes wrong. During the pandemics, actually, you see that the stakeholders of the medical data, or I would say the health-related information, is actually extending, because it's not only about patients and doctors. It's even about your gatekeepers and local, let's say, street administratives. So in this case, some of the information, when it's exposed to them, many of them are not really behave really well. In this case, something goes wrong. That is because, it's not because you don't really have a rule. It is because that traditionally they will not have access to these health data, that actually they're not trained to keep the data safe. So that's why something bad happened. In China, we have multiple ministries launching the privacy protection in a way that they say, this is the full ministry version, that they said the need to collect information of community residents should be clearly prompt to the community residents and obtain consent, and clearly used for the prevention and control of the virus. And for other purposes, you have to re-obtain the consent. I would like to summarize with 3 points that I would like to mention. One is that really that we're in the process of reshaping the public health crisis management infrastructure powered by big data analytics and AI. Many things are changing, like what I'm mentioning about the stakeholders of these public health crises. So the stakeholders, like I said, it's extending, not only about patients and doctors. So who is taking care of the education, training of the ethical principles of the...
You may have lost Yi for a minute.
Yeah,
Okay.
I'm actually finishing.
Oh,
for
okay.
example, a strategic long-term research on safety and potential risks for disruptive technologies. That's something that we can learn from the COVID-19. My third point is really that we need to rebuild and renew. We're rebuilding our global coordination for shared and interconnected future for humanity. With all that, I thank you for your attention. For something that I didn't say that's covered in a recent report titled Data, AI Governance and COVID-19, if you're interested. Thank you.
Thank you so much. Thank you all for your really interesting presentations. I would like to invite the audience again to please submit any questions for our discussion using the Q&A, and we will relay them onto our panel. But I would like to start with maybe a question comment that unites a lot of what was going on, what was talked about here. So, you know, Christoph mentioned really that we have this global consortium, but there really is a lot of consensus on the ethical principles around the use of AI. However, in the other three presentations, we then heard of a lot of examples in Europe and in Asia of how, you know, even though we have a lot of common tools that could be used, the implementation looks really different and the acceptance looks really different. And we saw, you know, I saw mention of a lot of common problems or factors in each of your presentations about communication, about design, about policy, about knowledge sharing and data access. So what is it that kind of is, you know, where do we get these kind of differences in implementation, and how can maybe a global perspective, you know, help with that, or and for any of you?
So maybe I think one of the problems we had during this pandemic, at least in my country, in France, but I think we're the same in different European countries, is the fact that there were a lot of misunderstanding. So people fear some terrific use of data. It was very strange. For instance, in France, and I think it's the same in many European countries, we have a social insurance system which is a global, and the state know many things about the health status of people. And it was strange because people fear that the knowledge that the state had and get from the apps could be used against people. And they say, yes, it's very new, and they never had this information. But in fact, the state has a lot of information. If you are ill, the state know exactly that you are ill, because so this information is encrypted, but it is centralized. It's necessary for social insurance system. And it's very difficult to explain the thing to people, and to explain that the fear doesn't correspond to real danger, and the danger are not there. And this is a question of education. And I think the difficulties is that the rhythm of scientific explanation is not the rhythm of the media, not the rhythm of the social media, not the rhythm of the TV. And as scientists, this is our role, and as philosophers, this is our role to try to explain, and to try to explain what are the difficulties, because there are some risks, we cannot hide it, but also that we have some solution, and that we need to trust solution and scientists. And this is a very big problem. I don't know what happened in other countries, but yesterday evening, so you know, we have this vaccine which was announced a few days ago, and yesterday evening I was listening, I was watching the TV, and I was so there were some poll, and you see that 50% of the French don't accept to be vaccinated, which it's really frightening, and so it's very difficult. And some of them say yes, because you have big farm, we will have a lot of money. Some others say, oh yes, usually a vaccine take 10 or 15 years, and it's not possible to have this just 1 year. So we have really to explain what are the scientific process that justify the use of some techniques, AI or biological techniques.
I would like to pick up on what Yi said about the effectiveness and ethics. So I think that's a very important point, since my general notion about AI ethics is that ethics should help AI become more trustworthy. Otherwise, people will not use the technology. It's the same with the vaccine. Jean-Gabriel, I agree completely with you. So, but if we are to develop ethical rules or guidelines which will not advance the technology, but which will just put brakes on the technology, I think there we will have a problem. And that is something that we currently see with the corona crisis. I think we are in a quite dangerous situation. Unfortunately, I think I have to say that, especially in Europe and other places in the world as well. But I think people will not accept this situation for very long. So if we don't find a way out of the crisis, which many Asian countries actually have found, then we will really run into problems with our democracies and our societies. So I think there we will really need to find a way somewhere through all the problems. Yeah.
May I also add that about the something that has been learned at least in China is the underrepresented groups. Actually, when your apps are actually required, you don't really have a choice for some reason. And then there will be a group of people, like for those who are without a cell phone. So what about the life for them? So for the medical system, but at first they don't really realize the problem, and then they say, oh, there are a lot many, so they have to have a way to actually give the recording saying that, okay, he is safe to be in the hospital. So there are mechanisms, for example, in Beijing, to taking care of these group of people. But I also would like to share a story which is really funny, but it gives some inspiring ideas. Accidentally, when you introduce the COVID tracker or the health code system in China, everybody has to use it. So it's like 2 weeks after a required information, and then someone who need to be caught 20 years ago because he killed someone. So he actually go to the police office by himself because he cannot really go into the restaurant. He cannot really rent a room because they don't really have a health code. So in that case, they say that, oh, this is horrible for them because they only have a fake ID because they never they never thought that they didn't have a chance to use the fake ID to pretend nothing happened. So that's something that's a version of the story that really happens in China. To summarize, I would say that really for the kids and for the senior aged people, it's really the group of people that when you deliver infrastructure saying this is required, and then at the same time you have to consider about them and to have solutions for them, so that your system keeps effective. And if those information is really required and you have minimized them and you could keep the data safe, and then that's the way to go, I guess.
Yeah, thank you. I think a lot of this points to the what we were saying, the relatedness between technology and ethics and the context, the social, psychological, political context in which it is. I think a lot of this relates to what we were hearing in our session 1 yesterday too, about issues like inclusivity and how this relates to rule of law. And we have a related follow-up question of how do we think about the new normal and stepping back from the new normal as the crisis hopefully wanes, and is there lessons learned or a global approach or something that we can look to in thinking about reversing this new normal of all the technologies we're seeing during the crisis? Yeah, Rafael.
I was reflecting on Yi's point. I think one of the variable that I in all our discussions keeps coming up is human autonomy, the sense that we are in control of our actions. And one thing that I have found common to both the concerns that in China from Chinese scholars and in the West is the increasingly this increasing strength of corporations. So in China, they are concerned because some of the data is collected through Alipay and WePay, and those are two corporations. And in the West, we are concerned about the possible increase of power from Apple and Google. Of course, what might be different is the concerns that we have about our states, but I'm not even sure about that. I think both in China and in the West, part of the population have obviously concerns about the state taking more control over us than it deserves. It's just that maybe in China, people recognize the public health value of the state being in control and providing something that it's being effective. It's just like Ji said, while in the West, every intent so far has failed. So we don't trust the efficacy of what the governments are offering. So we are giving part of our privacy for nothing back. That's what I think many people feel, rightly or not. And in China, it seems that people are saying, well, we are giving some of our privacy, but look, we're really proud. We don't have any cases of COVID, and that matters, I think. But I wanted to ask Yi about I don't know if my reading of the Chinese concerns about the possibility of corporations getting too much power is real, or maybe I just came up with some literature that is exceptional.
I'm sorry, I didn't quite hear your question.
So what I've read in some of the Chinese scholars' literature is that there are some concerns in China about Alipay or WeChat gaining more power because they are collecting data. And that will be the same in the West to Amazon or Apple, Alphabet, Google, or Apple gaining more power through the tracing.
Yeah, I get it. I think pretty much the same thing. And the worry is truly on the same page. I think, because I'm a scientist, what I can see what the government is doing is something like this. For the Ministry of Information Technology and Industry, they will periodically release a list of apps who is against the current personal data protection laws and regulations in China. So you will always see those big names like Tencent, like Alibaba. So many versions of their apps, different services, they're questionable or being in a risky part for data collection or data reuse, consent. So it happens time and time again. But actually, what we've been worried about is really pretty much the similar thing. We're not saying we trust Tencent and Alibaba. There's no way that you can trust them. Based on the cultures in China, the people in here trust the government a lot more than for those companies. This is what the culture is really about. But that's based on I think that's based on the behavior. So when you see those names, you see, for example, for me, like it's an instant chat SMS in China. It's called QQ. That's the product of Tencent. We've been using it for 20 years. And then you see that in many cases, their names are on the list. So they're required to make the change in 2 weeks. Otherwise, they will be off the shelf. So that's something happened in China. What I also would like to share is really that they have to raise their transparency, while at the same time, I would like to suggest that for those ethics researchers, and AI practitioners, they need to sit together to see the problem. For example, when we claim that both in China and also in Europe, we have different versions of the data regulation policy, but when you go into the details, like data erasure, if someone is not happy with the policy, how can I erase my data? And GDPR says, yeah, of course, the users have the right to erase their data instantly. So everybody is saying that, oh, we're 100 completely comply with GDPR. I'm saying no one is really complying with GDPR, because what GDPR says that you have to remove your data in an instant way, but actually for those data in the database, it's more easier to be removed. But for those data that has been learned by the AI model, they will never be actually removed from the model, because you have no way to remove the data from the AI model. So you have to retrain the AI model. So actually, when are you going to retrain the model? A month of time or even half a year time. So there will be technical challenges to actually implement those ethical principles that this is why we need to actually collect the efforts together to deal with the technical challenges that are required for a trustworthy society.
I want to maybe pick up on, I mean, both of you are talking about bringing up, we've seen this a lot over the course of the 2 days, the different actors that are all involved in this kind of idea of responsible AI. And you mentioned, I think yesterday we also talked about, should it be private companies or public, sector actors advocating or producing or implementing or communicating about these different tools. And that may be different across cultures, who's the most important actor, and also bringing it back to the Global AI Ethics Consortium and the role for research and academia and all these different stakeholders have a role. Do any of you see kind of different relative roles these actors should play? And does that change depending on the context we're in?
Caitlin, can I also add one point about the new normal, which everybody is in the process of learning? I like the term in person, but actually I don't see a bright future for that, because during our survey, when we asked the question around May, saying that okay, now we don't really have one positive case, so can we suggest to remove those infrastructure because there's no positive case? I never thought that there are more than 20% people saying, no. What if it happens again? It is happening again in June, a month later. But when we are doing the survey, people are so getting worried about this. So it seems that for some of the technology that has been introduced to the society, it has fundamentally changed the way people perceive our relationships and the infrastructure of the society, which is really disappointing, I would say. For example, by using the mask. Now we're not having any positive case, but everybody is wearing a mask. And when you go somewhere, when you are not, people say that, oh, why not? So we don't really have a police taking care of this. And people say that, oh, it's in cold winter. So what if somebody get cold, get a fever? I mean, a fever is not COVID. So you will have a fever every winter for many of us. So why that? So this is why when we're talking about the new normal, I'm not really positive saying that we can actually going back exactly where we were. But we really need to accept many things like this for the new normal. I guess this is a common challenge for the society everywhere.
Maybe there are 2 points I would like to mention. The first is that the fact that was difficulty with AI, ethics of AI, is that the devil is in the detail in some way, and so many people agree with the general idea, but as you mentioned, the difficulty is that you have very small difference, which can everything. The fact that you think your data are safe, but maybe the data can be reused by some person. I mentioned, for instance, the GAIEC protocols, and so they say that it is decentralized and maybe that, our data are safe, but in fact, it is not really decentralized. So this is the problem, and this make people fear AI. And in this respect, I understand people who don't know exactly many things about AI, the notion, the fact that they distrust people. So it's very important to be able to have independent actor which could certify that people check some property. And I think in the future, it will be very important for us, especially for tech of AI, to have some kind of organizations which make people trust exactly what we are doing. So this is the first point. The second point concerns, and we had a question on the Q&A about this, concerns the cultural aspect of acceptance. And I think depending on the society, people fear something. For instance, in United States, people fear the state and they trust big tech. So in Europe, especially in France, people fear the private company, and they have some trust, not totally, but partial trust in government. And I wrote during the pandemic, I wrote a paper which was called about, you have a disease which is a very famous disease, which is post-traumatic stress disorder. After some past event, which is a very traumatic event, you have some troubles. The fact that you every time you this past event make intrusion in and change your representation of things. And I think it's really important today in different society. We have in our history some past event which change our understanding of the future. And it's very important to be able to understand in each society what are the stress, what are the traumatic events which explain the reaction to novelties.
I think I mean, so far all of our questions have just been kind of naturally answered in the conversation, so I haven't been bringing up too many of the audience questions. We are nearing our end of time. If our next panelists will forgive me, we'll go over a few minutes just to wrap things up. The only last question that we have, and I think it actually goes back to what I was saying, but adding in a stakeholder I forgot, is talking about coordinating or the role also of international bodies like the WHO, the UN, these type of bodies, and what role, in addition to all those other stakeholders I mentioned before, might we see in global approaches to manage AI and the use of AI, especially in health crises. And so maybe if anyone has, we'll go through the kind of last words of everyone right now on that topic or any other one.
Can I take this?
Sure, go first.
Thank you. So firstly, WHO has released a contact tracing ethical recommendation months ago. So that's with international collaboration under the framework of AI ethics and governance expert group for healthcare. So you can find it on the website of WHO. But I think it's not forced. So that's a recommendation. So people are suggested to do it. Well, secondly, the UNESCO has the global recommendation process to draft the first version of the global AI ethics guideline. I think pretty much the same thing when it's officially released next year, because now it's been in the first version, asking for feedbacks. I've been participating for both of these two, but actually the challenge, the common challenge would be that when countries would like to try or adopt those ethical principles, how about the evaluation? Who is taking about the evaluation? That's the hard part. Do you really have an organization who is taking care of the designing AI systems as a starting point to really apply these all the way down to the whole life cycle of the AI services? That would be a real challenge. So I think as a global organization like ours, we need to have the responsibilities to actually contribute to not only forming the consensus, but also providing services like evaluation tools, sharing the evaluation best practices that really ground those ethical principles.
Yes, I should. I would have lots to say about these issues, and I think the WHO will certainly play a huge role in rolling out the necessary applications here. However, for reasons of time, I would limit myself to a very few words. I think we are only just beginning to understand what role AI could play in fighting health crises, and hopefully we will also gain the necessary trust that these applications will need in order to be adopted and in order to also to restore peace in our societies. That's all I want to say.
Thank you so much. Jean-Gabriel, Raphael, have any final words for us, and then we'll wrap up.
No, I totally agree with the fact that what we need is to be able to certify that the AI tools that will be developed will check some ethical criteria. And this will be, I think, the difficulty in the future to have independent institution in each country. So maybe, I don't know if international institution would be good, but maybe what is important is that people trust this certification. And I think this is a challenge for the future. It means that we need to build this independent institution, but also to explain it to people and to explain that, okay, you have this and this property, which are very important. And I think because you have a debate, many people think that, yes, we shall have norms about AI. I'm not sure that norm is sufficient. I think what is important is to have some label and to explain people that they can choose by themselves and they have some properties which are certified by some independent society or something like this.
Thank you.
I can only add that I think initiatives like this one, Christoph, that you're leading, where ideas from different parts of the world on AI ethics are brought together, are essential. Because if we are able to develop a better shared understanding across different nations, across different cultures, it will help us produce more trustworthy AI systems. So particularly focusing on the things that are common across East and West, for example, it's really important. Finding what works in one place, trying to adapt some of those ideas to the Western cultures. I think finding that common ground is essential, and I think events like this one are very important for that. So thank you for organizing it.
Thank you all so much, Christoph, Raphael, Jean-Gabriel, and Yi. Thank you so much for presenting with us. Thank you to our next panelists for being a little patient. Our discussion was going so great. And I would urge you all also to check out on our website, the Global AI Ethics Consortium, more about it and more of our members. So yes, thank you all. We will move right into our next session where we will hear from ethics and AI-enabled decision-making with Christoph staying on as our moderator. Thank you.